Imagine if information about your community could be used to improve lives, like finding the most effective ways of treating illnesses, or a better understanding of how to support the infirm and how to give children the best start. Most people expect that government data will be used for research, and now the Scottish Informatics Programme, or SHIP for short, will make this easier, quicker and more secure. SHIP is a publicly funded state-of-the-art system that links data and makes it available for research while preserving the highest standards of privacy and safety. Over a lifetime, an individual accesses many services provided by lots of different organizations. Each time, information is recorded about who they are and the details of the encounter. We call these records administrative data. Over the years, organizations collect a wealth of administrative data. Within each organization, there are data custodians. Their job is to manage the organization's data and ensure that client privacy and confidentiality is maintained. Each organization generally only uses its data in-house to meet their own specific needs, and because this data is not easily shared, it's often impossible to discover important relationships and trends across multiple data sets. However, SHIP can link data on the same population from different sources without any details about any particular individual ever being divulged. All names and addresses are removed from the data so no one can be identified. Now let's consider the following example where a researcher using linked data can make a valuable contribution to society. Our researcher suspects that babies born too early might have some difficulties at school, something not well studied in the past. If she is correct, she believes that services could be set up to better support their development. Realizing that she will need birth, health, and education data to properly test her theory, she decides that linked data will be a valuable research tool. So she enlists the help of SHIP. A SHIP advisor facilitates a roundtable negotiation with the custodians of the hospital birth data, the early childhood health check data, and the educational outcome data. During the negotiations, the custodians comment on her research questions and raise any concerns they may have about the use of their data sets. The meeting has ensured that the data will be able to answer her questions and that the data custodians support her research. Next, our researcher seeks ethics approval. Satisfied that her research is ethical and will benefit the community without breaching the privacy of others, she is granted permission to proceed. The custodians from the participating organizations are notified of her ethics approval and give their final sign-off on the application. Once all the permissions are given, the process of linking the data for this research project is initiated. To protect privacy, identifying information like names and addresses is never brought together with information about people outside the organization that it comes from. So custodians send identifiers only to the indexing service. The indexing service is where they work out which identifiers in a data set refer to which people in other data sets. Once the indexer works out which records refer to the same person, he allocates numbers to them, just for this project, and he makes a table showing which records are related to which, a linkage key. He still doesn't get to know anything about any of the people. The indexer sends the identifiers back to the data controllers they came from, but with a linkage number added to each record, which is just for this study. The linkage numbers the other controllers get are different. Only the indexer holds the key that translates one to the other. The indexer sends this key to the safe haven only. The safe haven is a secure environment where the researcher can have controlled access to the data. Now all the data controllers send their information that our researcher needs to the safe haven, identified only by the linkage number. In the safe haven, the data sets are zipped together using the key provided by the indexer. Now she can analyze the linked data set without ever knowing who any of the people are. Using the linked data, our researcher discovers that while some of the babies born too early do go on to become child prodigies, she also found that they are likely to have some difficulties in their very early schooling. She delivers her findings to policymakers, doctors, the data custodians, and some of her peers. They're impressed with the relevance, timeliness, and accuracy of her research and decide to review medical practice and develop some pilots of promising early childhood development programs. The Scottish Informatics program joined up data for better decisions, answering the important questions for Scotland through legal, secure, ethical, and efficient data linkage.